Clayton, State Epidemiologist, and Kim Malcolm-Risden, Secretary of Health, here with me, and we'll provide today's update. I'll start with Dr. Clayton, and then we'll take your questions.
All right. Good afternoon, everyone. So I did want to start with just providing an update on the data that we are releasing on our dashboard. So I'll get into more of the details on the cases that we're reporting for today, but we did identify an aberration in some of our data reporting, and that it was isolated only to new cases and new tests that have been reported to our health dashboard on Tuesday and Wednesday of this week. The aberration occurred Sunday evening and was something that was an issue with our automated geocoding process of all new test results that are received into our electronic disease surveillance system. So we did identify that issue and corrected it by last evening, Wednesday evening. Just to give a little bit of background, the geocoding process is a verification step that we use to ensure that the state and county of residence are accurate when we report out the test results, both positive and negative, that we receive on an individual. So our process, the reporting process did not verify those lab reports that came in as South Dakota cases. It actually left that information blank. So it did impact our data cuts that occurred at 1 p.m. on Monday and 1 p.m. on Tuesday that are reported by noon the next day. And the dashboard data now has been updated to include all of that corrected data. That's kind of the general overview, and I just wanted to say that we have implemented that fix to the geocoding process and have instituted additional review steps in terms of our end-of-day processing to get those numbers pushed out to the dashboard and to report to you folks. It's important to keep in mind that when we're pushing this data out, that we have completed and worked towards completing those cases that have been reported to us, and that did not impact our processes. It did not impact the receipt of laboratory test results. It did not impact our investigation process or our notification of close contacts. So I just wanted to make sure that was clear, that it was only an issue on the reporting out of our cases that did not impact our investigation notification. So go ahead and take a look at the updated case counts for the past 2 days. For today, August 27th, we are reporting 343 new cases in the state of South Dakota. This does include 2 new hospitalizations. We've had 0 new deaths that have been reported. We have a total of 136 newly recovered individuals who are no longer able to transmit the COVID-19. And then we have 2,651 new tests that have been reported to the Department of Health in the past 24 hours. This does bring our total COVID-19 case count in the state to 12,194. Of those, 2,000 cases are considered active infections, and we have reached over 10,000 now recovered individuals in the state. 10,032 individuals are considered recovered. We have 75 individuals who are currently hospitalized, and we have a total of 62 deaths. 162, excuse me. And then the total tests that have been reported, and this information is up on our website now, is 183,918. And that's among 141,284 unique persons. So the other thing that I wanted just to mention before I provide some additional updates on what we're seeing in some of our cases and hospitalizations by age is just that when we did update the dashboard to include a better clarification on what we mean when we're talking about currently hospitalized versus ever hospitalized. So we, just for full awareness, we do use 2 different that information. Currently hospitalized includes South Dakota residents as well as out-of-state residents that are hospitalized in South Dakota facilities. And it includes not only COVID-19 cases, but also includes suspect cases that are in the hospital and under transmission-based precautions to avoid any potential risk of spread of COVID-19. As a differentiation point with our ever hospitalizations, that includes only South Dakota residents that are hospitalized, and that those individuals are COVID-19 cases. It doesn't include suspect cases. It does not include out-of-state residents in that ever hospitalized number. So the other information that I wanted to provide in terms of COVID-19 cases is just kind of like looking at the two extremes of the age groups. So we do have about 36.1% of all COVID-19 cases have occurred since the beginning of the pandemic among those persons aged less than 30 years. When you look at their hospitalization, though, that group, less than 30 years of age, makes up only 10.7% of all hospitalizations. So while we do see cases in those younger, school-age children, young adults, they're much less likely to be hospitalized due to COVID-19. Now, when we look at those individuals who are 60 years of age and older, and that is start of the CDC-defined age group risk category, we see about 15.7% of cases occurring in that age group, but 47% of all hospitalizations. So there is a definite difference when you're looking at the risk of hospitalization by those different ages. The last update that I have for you today is just looking at that some of that data over time. So we've talked previously and looking at on a month-by-month basis, what we've been seeing for those that are among the school-age population. So combined here, 0 to 19-year age category, and we have seen increases, although they've been just a few percentage points. We have seen increases in those who are 0 to 19 years of age. So between March 10th and April 15th, that age group represented about 5% of all cases. Between April 16th and May 15th, they represented 11% of all cases. Between May 16th and June 15th, they represented about 12% of all cases that were reported in that time frame. June 16th to July 15th, they represented 15%. And then July 16th through August 15th, they represented 17%. So this is not cumulative. This is looking at only those cases in those individual months. And you can see we had an increasing percentage of cases among that 0 to 19-year age category. Now we have seen a little bit of ups and downs with those in the 20 to 39-year age category, going from a high of 44% to a low of 39%. And so most recently, from July 16th through August 15th, we saw 42% of cases occurring among those young adults. So,
one of the other things I would just mention by way of, keeping our eye on the metrics that are important to our COVID response are rates of death. And so, obviously, we report new COVID deaths that happen among South Dakota residents on a daily basis. But looking back in time and looking at that more vulnerable population of the 60 years and older population in our state, between March 9th, when we saw our first cases, and July 21st, we have actually seen a 2% decrease in the number of deaths among 60 years and older residents of South Dakota this year compared to last year. So even factoring in COVID deaths among that group, we are still lower this year compared to last year.
All right, I will unmute our lines hopefully and take your questions. Thank you again for your patience.
This is Morgan with the Rapid City Journal.
Go ahead, Morgan.
Can you clarify if the 343 new cases today is because of like the error in reporting? So that's cases from Tuesday and Wednesday, or is that just everybody that was tested within the last 24 hours? Those are all that's the 343 new cases.
Yep. So thank you for allowing clarification. So we have corrected the prior numbers that we reported out on Tuesday and Wednesday. So the 343 new cases represent the number of new cases that we had received in a 24-hour period. And so that would have been 1 p.m. on Tuesday through 1 p.m. yesterday. In that 24-hour period, we received 343 new COVID-19 cases.
Okay, so that would make today a record day for reporting new cases then. Does any of that have a tie to the mass testing that's going on in Sturgis? Can you give any update on that?
Morgan, we do not have aggregate results yet from that particular mass testing, but in the county breakdown of new cases, you'll see that Meade County has 33 additional new cases.
Okay.
So, sorry, Morgan, I was just going to add in there that we have received a notification of a total of 88 South Dakota residents that have been associated, that have become COVID-19 cases that have been associated with attendance at the Sturgis rally. And so I don't have a breakdown of where those cases are, but that does also factor into some of the case increases that we are seeing.
And then for the 88, those are from South Dakota. Do you have an update of any cases coming from out-of-state residents who may have contracted coronavirus at Sturgis, or have since gone home and like their symptoms have developed and now they have it? Do you have any update on that?
Yeah, so we don't specifically track all cases that may have occurred. We are notified when there are specific exposures that require us to either follow up with South Dakota close contacts that have been identified through a case investigation in those states, or when there's a concern and we may need to issue a public notice. So I don't have an updated number because we only receive those for those specific reasons.
Next question.
But have you received any from other states though, notifying back more than the update of 3 that you gave on Monday? Is there any more?
No, we have not received any other updates.
Next question.
Okay, thanks. This is Lisa with the Argus Leader.
Go ahead, Lisa.
What is contributing to the rise in the cases among adults in their 20s, and does that pose a risk to the community at large when cases among young adults are increasing?
Well, Lisa, as we talked before, as anybody comes into contact with other people, it increases their risk of exposure, and we know that the younger population in our state, as in other states, has been coming into contact with others at a higher rate, is the suspicion, and we think the numbers are bearing that out. Again, we encourage people to, to continue to take precautions, to do everything that we've been talking about since the beginning. So, washing your hands, staying at least 6 feet away from other people whenever possible, just avoiding those crowded areas, masking if you want to consider that, and not taking this lightly because we want to slow the spread of COVID in our state.
Next question.
Mark with the Black Hills Pioneer.
Richard, Alcester, Hudson.
Go to Mark with the Black Hills Pioneer.
The Lawrence County death that was reported yesterday, was there a delay in reporting that due to the similar circumstances with the overall tests? Because that gentleman died on...
we'll tell you who has signed on to do...
So, no, what we can say is that, it only impacted new tests that we had received, and so that the notification for the death that occurred in Lawrence County was not delayed through the, with this aberration. It was only relating to new cases and the total number of laboratory test results that we had received.
And then are you also seeing a decline in the trend of hospitalizations per case?
I don't have that information directly in front of me, but, we can definitely follow up on our next media briefing. We are thankfully lower in our total hospitalization rate and our death rate than many other states. And so, we can provide more specific information on that during our next media briefing.
Next question.
JP, KORN News Radio.
Go ahead, JP.
Thank you. Earlier this week, the CDC revised its guidelines saying asymptomatic people no longer need to be tested for COVID-19, even if they've been exposed to the virus. So how will this impact the current Department of Health guidelines and recommendations?
So that's a very good question, JP, and what I would say is that, we did see that change in CDC guidance. We have also seen, as early as this morning, that CDC is reevaluating their stance, and so we're waiting to see that change reflected on their website. We have a focus on testing all individuals with symptoms in the state of South Dakota, and that does include those who are symptomatic and have had close contact. We also do have a priority of testing asymptomatic close contacts to a COVID-19 case, and that would be primarily focused within household settings where the proximity and the duration of exposure makes it a much greater likelihood of spread of COVID-19, as well as individuals who are identified as close contacts and are healthcare workers or live or reside in congregate living settings. So, we're going to wait to see what CDC does in terms of their revised guidelines, but at this time we are not modifying our focus on asking medical providers to test symptomatic and a subset of asymptomatic close contacts.
Thank you.
Yes, Ben with the Daily Plainsman.
We'll go to Ben and then to Ray.
Yes, I just noticed, over the weekend when we had the 251 positive case day, we had pushed we pushed over the 1,500 active case mark, and then today's pushes us over 2,000 for the first time. Is there anything different that the Department of Health is going to do or suggest or make any recommendations of at this point, with right now significantly more active cases in the state than we've had at any point during this virus?
So, Ben, the guidance to people who have COVID remains the same, and those individuals are directed to isolate themselves and take precautions so that they are not spreading COVID. Any of those close contacts of those individuals are also provided a directive to self-quarantine for 14 days, monitor for symptoms, and stay away from individuals so that if they do, in fact, become positive, they are not spreading COVID to other people. So we will continue to investigate every single case and conduct contact notification in a timely manner so that we can appropriately manage COVID in our state.
And this is Dr. Clayton. What I would also say is that, CDC guidance for health departments in terms of our processes around conducting case investigation and contact tracing, there's a guidance from CDC, and so we do look to CDC to implement any recommendations that they have to improve our processes.
Yep, thank you.
Next question. All right, sorry, I think I was supposed to go to Ray. So we'll go to Ray.
Yep.
Okay. Hey, thanks. So you mentioned the low hospitalization rate for the younger age group, 20 to 29 and 0 to 29, but a increasing rate of COVID cases, while at the same time those over 60 aren't showing as much of an increase, and their hospitalizations they account for more of the hospitalizations. Can we conclude that those people over 60 are just doing a better job of following your instructions, and that they're perhaps prolonged doing a continued job is being affected by those younger? I mean, are they just doing a better job when you look at the stats?
Well, Ray, I think individuals that are in higher risk categories have taken COVID very seriously and are taking precautions. I think the data shows that. I also think it shows that COVID is much more dangerous to people over a certain age. And so that's why we're seeing more people in that hospitalization category that are over age 60. But again, from an overall death rate perspective, we are actually seeing a lower number of deaths among people age 60 and over this year compared to the same time period last year.
Next question. Anybody with another question?
This is Mark with here again.
We'll go, Ray, I'll let you follow up, and then we'll go to Mark.
Thank you. Unmute, Mary.
Ray, did you have a question?
Hello?
Yeah.
Oh, yeah. Given that situation with the young people, and someone asked about restrictions, Governor Reynolds in Iowa just issued an order to close bars, taverns, nightclubs in 6 counties that have universities, and then higher rates of COVID. You mentioned continuing to recommend masks and social distancing, but could something done in a neighboring state like that give you pause, or would you at least consider that? Because we see cases rising in our university cities in the last 3 weeks, particularly.
So, Ray, consistent from how we've handled this response from the beginning, we're going to continue to educate individuals, encourage them to take personal responsibility, to implement, practices that are going to help us minimize the spread of COVID. And, folks have generally been very good about doing that. And so we're going to continue to provide that education and help people do the right thing.
Okay, thank you.
I'll go to Mark with the Black Hills Pioneer.
So in that 60-plus age category, what was the top 3 leading causes of death in 2019 and so far this year?
Historically, and we can follow up more specifically, the leading causes of death, which you would find on the DOH website, are cancer, heart disease, I don't know what the third one would be, Alzheimer's, when you're getting to 80 plus, is going to be in the top 10.
All right, next question.
Jack
Alcester Union Hudsonite.
I heard the Alcester Union Hudsonite, and then I heard Jack
All
Cobb.
right. Thank you. They're beginning to see reinfections of people who've had COVID. Of the 10,000 recovered here in South Dakota, have you begun to see that? They're getting it again?
So what I can say is that we have had individuals who have tested positive after their initial test, and similar to the way states conduct their investigations and their reporting, we look at all individuals who have that next positive test. The focus is that within a 90-day period, reinfection is unlikely, and that is information that is available on CDC's website. So we do primarily focus on individuals who have a new onset of symptoms, and we do work with their medical provider to assess potential for reinfection within 90 days as well as past 90 days. And there have been and are starting to be some initial reports of potential reinfection. but that is not a widespread occurrence. And we have had some individuals who have tested positive, in our cases, but we have not seen, what I would call a true reinfection at this point. We have some individuals who have continued to test positive with the very sensitive PCR testing, but that does not mean that they are automatically identified as being reinfected. What we're seeing is actually non-viable virus being detected by that very sensitive testing platform. So I did want to say that even if an individual tests positive again, that does not mean that that is a reinfection.
Now we'll go to Jack Cottle.
With case numbers jumping up this much right now, from a medical perspective, how big of a concern is that?
Well, Jack, again, I think, the case numbers are, of course, an important metric, but we look at various metrics, every single day and multiple times a day to have a sense of where we're at with our COVID response. I would point you to the hospitalizations. And so even while we see, we may see a daily increase in cases, the rate of hospitalization has remained very low. ICU bed use and ventilator use due to COVID conditions has similarly remained very low, and so that would be an indicator of severity of disease among hospitalized individuals. And so we're also obviously very much looking at how many tests are being conducted and test positivity rates and other factors that you'll find on the website. So I think you need to take all of that information into context to see what's happening around COVID in our state.
Next question.
Perry Groten with KELOLAND News.
Go ahead, Perry.
So going back to the CDC guideline changes, which may or may not be happening, what is the public supposed to make of this? Is this just going to add further confusion to them about whether or not they should get tested? And does it give them confidence that, the government health leaders have much of a handle on the testing situation?
Well, I think it's, important to have a focus that, this is a little change, I guess, on the CDC's part, around their recommendations for individuals who are asymptomatic. The focus that we have is, we have already established priorities, and individuals, medical providers, and our health systems are working, within those priorities to identify their ability to and their willingness to a person who's asymptomatic and identified as a close contact. So, we have a focus of testing all symptomatic individuals, and that still remains, even in the new old CDC guidance. The focus is that, whether individuals are asymptomatic close contacts and, whether or not they can get tested is done so at with various levels of priority. And so we focus on those who are hospitalized, those that are symptomatic, and then those at the highest risk of asymptomatic close contact, which would be individuals within the household setting. So yes, that we recognize that there is a change in CDC guidance, but it's very minor in terms of the overall impact in the state of South Dakota.
Perry, this is Secretary Malcolm-Rice, and I'd also point out that obviously our knowledge about COVID and testing and treatment and sequelae, everything about COVID has been evolving since the beginning of this pandemic. So I think people appreciate the fact that we continue to learn about the disease and really see our responsibility making sure that people understand changes as we learn more about the disease.
Thank you.
Next question.
Ray from KELOLAND, I have one more question related to transmissions, if I could.
Go Go ahead.
School started, and community transmission is key to different phases of schools, whether they continue in person or rearrange their classes. And it's also key for nursing homes as they move from phase 1 possibly to 2 and 3. The numbers today and then from the last few weeks have to be concerning. I'm hearing they're concerning from school officials and from nursing home officials. How can the DOH respond? How does the DOH respond to that? Because you mentioned the need to continue the spread, but the spread seems to continue. I mean, is there a point where, how can you respond to that? Because the schools are already having to do some switching, and seems kind of a confusing message, or not exactly encouraging the numbers anyway.
So, what I would say around that is that, we have been working very closely with, the South Dakota Board of Regents, the Department of Education, hosting, calls with schools, the K-12 schools, and with our colleges, universities, and technical colleges. The guidance that is being used for decision making, there's a lot of the data that's coming from the Department of Health website, and that was really the reason for the change in the definitions for the level of community spread. And so, we're providing information, to help inform decisions for each of those universities and colleges and K-12 schools, so they can make appropriate decisions on, how they deliver learning, whether that's e-learning or a hybrid model or all in person. And so, the focus is really using the data to make those informed decisions, so that individuals can take advantage of learning opportunities.
Next question.
Josh, Dakota News Now.
Go ahead.
I just got a question about the data on the dashboard today. As far as active cases, it went up nearly 500 from yesterday, like even more than the number of new cases. Just wondering what's the deal there?
Yeah, so that is reflective of the increased cases that we reported out over the past 2 days, and that correction that has been made, in addition to the 343 cases that we are reporting out today. So yes, it is a large increase in our total number of individuals who are considered active infections, and it falls in line with what we're seeing in terms of increasing cases within the past several weeks.
We have time for one final question.
Ray from Kettleland, I just want to follow up on what Dr. Clayton said. I understand that you're providing information to help schools make decisions and things, but at some point a school official may be asking you, how can you help change the information we're provided? How can you help change the community transmission? Is there any point at which the DOH may say, look, the transmission's gotten too far, or case numbers have gotten too high, or we have too many counties in substantial or moderate transmission? I mean, I understand that, the hospitalizations rates are low, things like that, death rates, but is there a point in which the DOH would help change the information the schools are working with?
So, Ray,
what's the tipping point?
We won't be changing the information that they work with. They need to have the most updated, accurate information possible to make those decisions about their schools and their school districts, and those decisions are made at the local level. So we will not expect schools to do, to change anything based on that data. We want to make sure they have the data and they understand, kind of what the guidance is around COVID, particularly in school settings.
No, I mean change the information as in change the situation. Say, hey, we've got too much community transmission. We need to do.
We're not going to be doing that. Those are decisions that are made at the local level.
So I mean, like enact restrictions or do any mandates to say, hey, is there a tipping point there?
So I guess what I would tell you is that in any case involving a student or a staff member at a school, we work directly with that school leadership so that they can take appropriate actions and that they understand the guidance related to the specific situation. And, you know, as we've worked with others throughout this pandemic, you know, we're very encouraged people in South Dakota do the right thing. And so, you know, we will continue to provide that data and that technical information, and we'll look for those decisions to be made at the local level.
All right. Thank you all for joining us today.